to turn things over to Kathy McDonald again, so that we can now begin to enjoy hearing about the SMDM or COVID-19 Decision Modeling Initiative.
Thank you, David, and thank you very much, Harvey, for that marvelous talk and overview, and just incredibly timely. We really appreciate it. I now will be giving you some background on what SMDM has been up to in terms of trying to make a serious impact on the pandemic. And then we will have a series of panels that I will also describe in brief to orient you to our plans. We've had an SMDM COVID-19 Modeling Special Committee that was formed in the early stages of the pandemic and is led by Lisa Prosser, Jillian Sanders-Schmidler, and myself, alongside many other members of our community. And the idea of the committee at the beginning was to provide connectivity between decision makers and decision modelers. We're working very hard on continuing to make that so. This is a part of that. After the committee was formed, we began discussions with the Moore Foundation and with their vision and our work and the work of many, we were able to partner to receive some support to develop a program in which we could offer grants, do a competitive process to offer grants to do work on the COVID-19 challenge, bringing people from our community and beyond into the work of forming an effort to have sophisticated models, ones that would face the important problems, not just be the easily solvable problems. The goal of the work of the committee and the work of the what was named the COVID Decision Modeling Initiative, CDMI, is to provide decision models that can inform clinical, health services delivery, and policy decision-making related to the COVID-19 pandemic. CDMI, this COVID Decision Modeling Initiative, also has the goals of understanding what the key priorities and critical questions are. There's a question repository that's been developed in order to support better decisions and outcomes during the pandemic. I've mentioned the grant making program. That's what will be featured here. And we have been working very hard to develop a repository of models so that there's a current one-stop place to see the modeling efforts, and some of the have structured information available. And so there's that resource is available too through the CDMI initiative. What we're going to have over the next set of sessions, and then later in the day breakouts, to get closer to those who've received grants under the CDMI, is we're going to be seeing projects that are varied, but they're using decision modeling techniques that can aid policymakers and other decision making to get to better outcomes in the face of all of the devastating effects of this pandemic. The focus of the work of these grantees, there's 9 of them, 9 recipients who received grants under the CDMI initiative out of over 60 applications. And this group is focusing on public health, treatment and vaccination, diagnosis, testing, and evaluation, together combined, building a knowledge base to inform the timely and effective response that we're all trying to have to COVID-19. Despite anything that makes it harder, all covered by Harvey's talk recently. We will have 3 panels. The first is focused, each of the panels involves 3 of the 9 grantees and their work. It's ongoing. They've all started and made real headway, and you'll see what they're working on and have that shared soon. The 3 panels are clustered a bit around a topic area beyond the broad topic area of having decision models to address issues of the pandemic. The first panel, starting at 10:05 or in a few moments is on the decisional context of the pandemic. The second panel, starting at 10:50, is focused a little bit more on the methods context. And the last panel, starting at 11:35, is focused more on the application context, specifically vaccines and treatments.